if you're a physician or a healthcare provider, the best instrument you have is your ears to listen to your patient. And if you listen to your patient and really take on board what they're saying, they're giving you the clues. You're the detective. You have the background, the medical background, and you should be able to eventually put the pieces of the jigsaw puzzle together.
Welcome to the Conditions for Recovery podcast. I'm George, a specialist pain physiotherapist and coach. If you live with chronic illness, you'll probably relate to how easy it is to get lost in hopelessness. Whether it's from healthcare appointments which lead to more questions than answers, the endless stream of despair content online, or just not knowing how to navigate the world when your symptoms aren't helping. I started this podcast to share the voices of people who have found another way, centering hope and agency as core first principles of recovery to show that another reality is possible. Today's guest is Tracy Jallow. I first became aware of Tracy through her inspiring advocacy work following her diagnosis with Antiphospholipid Syndrome in 2008. Since then, she has become a vital voice in the healthcare community, serving on the expert patient group for King's College London. Her dedication was even recognised with a British Empire Medal for her services to volunteering. I'm really honoured to be chatting with her today. Hi Tracy, thanks for joining me.
Hi George, thanks for having me. Thank you.
No worries.
My name's, as George has introduced me, Tracy Jallow, and I'm a person living with antiphospholipid syndrome, as he mentioned. Unfortunately, it took 17 to get a diagnosis. So I was 21 when I had my first symptom, and I didn't get diagnosed until I was 38. And in that interim period, I was clotting off organs in my body and causing my internal organs damage, hence why I live with pain. Because if you think about blood can go anywhere in the body, and therefore antiphospholipid syndrome can affect any organ, your bones, your joints, your organs, and everything like that. So after finally getting a diagnosis, I thought about how I would deal with it, and I decided that rather than be negative about it, I wanted to do something positive with it. Why had it taken me so long to get a diagnosis? Because if I'd been diagnosed earlier, my health outcomes would have been particularly better in my circumstances. So I set about trying to raise awareness of what antiphospholipid syndrome is, because at that time, anybody I spoke to didn't even know what it was. I educated myself, and then I started educating others about the condition, which led me into writing a paper that was published in the British Medical Journal about my road to diagnosis and all the things that I went through to get a diagnosis. And following on from that, I was invited to become, as you mentioned, expert patient at King's College London. And then later on, I was asked to be a patient educator at Guy's and St Thomas Hospital, where I teach year 2 medical students a range of different things. And in the last 3 years, I've joined the Royal College of Physicians Patient and Carers Network, where I'm able to put a patient's voice on the input into healthcare in the NHS.
And what you said earlier about the significant delay in diagnosis and the impact that had, the consequences that had, and then actually going, well, I can do something with this information to help others. It's really phenomenal, to be honest, that is the path that you've taken. And I know I've said it already, but I am actually really honoured to be having you today to speak to. So in terms of that early period, when there was that diagnostic uncertainty, and also presumably, although please correct me if I'm wrong, when you initially were diagnosed, because as you said, there's a lot of lack of knowledge and understanding about antiphospholipid syndrome. What sort of messages did you receive from either healthcare or online spaces?
Well, in the early years, pre-diagnosis, I was lucky in the sense that I was believed. I think to put a bit more perspective on sort of like my condition and the damage that has happened to my body, the first major thing that happened to me was that I had a blood clot to my bowel and my bowel burst, which I didn't know. And I was sort of like carrying on in pain until like I couldn't carry on in pain, and I was admitted to hospital, taken down for emergency surgery, which they thought was perhaps um, a burst appendix or something like that. And when they opened me up, they realized that my bowel had burst. So I had a resection. I didn't, well, the surgeon actually told me he didn't put a colostomy bag on me because I had a 1 month old son at the time, and he felt that I was too young and he took the risk and he didn't put a colostomy bag on me. But I continued to have excruciating stomach pains, even worse than childbirth. So, for any women out there, they will know how painful that is. And this was so debilitating to the point that I would vomit, through pain. So, that was one major thing that was going on for me. And I was being referred to gastroenterology, this, that, because nobody could seem to understand what was going on. Did I have Crohn's? Did I have celiacs? And the good thing was that what I was believed. So I know that many people aren't believed, but that part of me was believed. Um, but also, I didn't realize that I was feeling pain. I know this is going to sound really, really weird. And I do know a few other people that have experienced this, that they'd lived with pain for so long, they didn't know they were in pain because it was a normality to them. And as you know, and I'm sure you're going to discuss on other podcasts, brain fog and fatigue. But I thought everybody felt how I felt. So the healthcare system was looking after me and they were investigating. But if anything, I self-doubted myself. I thought, well, am I making a fuss over nothing? Is there actually anything wrong with me? Because things were coming to a negative conclusion. There was nothing being found. We know my bowel had burst. We didn't know why. They'd resected it. Apart from this pain, everything else appeared to be normal. So being passed around with that. So my bursting was my first thing. The second thing that we found out was my legs. My legs were hurting, and I just thought, oh, it's part of getting older. I wasn't even old, to be quite honest, but I thought, oh, growing pains, getting older, etc., etc. But actually, later on, they found out I've got double popliteal artery occlusion, which, for the people listening, it is your main artery that runs down behind your knees and supplies the feet and the legs with blood. And I was extremely lucky not to have lost a limb because you can have ischemia from this particular thing. So somehow my body's very strong and pushes that blood down into my feet still somehow. So double popliteal artery occlusion, um, perforated bowel. I also went to A&E at one point with extreme stomach pains, and they did a scan on me, and they said, "Oh, your portal vein has thrombosed." And I was like, "Okay." They said, "But it's okay. Your blood has rerouted." So I've got portal vein occlusion. Another time, I turned up at A&E with excruciating pain in my back, and they looked at my kidneys and they said, "Oh, you got a kidney infection." But later on, we found out I'd actually occluded a kidney. So I now have chronic kidney disease. I have a 38% kidney function. Um, I also, on diagnosis, they found out, by the way, that I'd occluded my kidney. So that was 17 sort of like years after my first symptom. And I've also got high signal lesions in the brain, which sort of like, causes a few sort of memory problems and cognitive dysfunction. So all these things are going on. The stomach pains later on were explained as when you eat, you get blood rush to your stomach to digest the food. And actually, because my blood was so thick and it was clotting, it was struggling. I'd already lost some blood supply because of the perforated bowel and the operation that I'd had there. So the stomach pains is actually caused by physical lack of blood. They have settled down a bit because I'm now on the correct medication to thin my blood. So my blood is doing better than before. But going back to the excruciating pain that I was feeling was probably because like my body just couldn't process what I was eating.
Crikey. There's an awful lot to discuss from what you've just said there. I think a huge amount of the people that I speak to are finding that they don't feel listened to, they don't feel heard, they don't feel believed. As you said, I think you went for 17 years without a clear diagnosis, but at the same time we're still being listened to about kind of individual symptoms, and it was joining the dots that took 17 years by the sounds of things.
Yeah, so the diagnosis, so following on from sort of like my leg problems, I was referred to a vascular surgeon. And the vascular surgeon obviously delved a bit deeper and did blood tests and realized there was something wrong with my blood and referred me to a hematologist. And the hematologist, who I describe as my little guardian angel, she was the first person that looked at me holistically. She literally took such a detailed history, sort of from childhood up until the current day, and really listened. And obviously, with her expertise, knowledge in the field, in her head, I suspected that she knew what was wrong with me, but she wanted a definitive diagnosis. So she told me that I was going to go into hospital for 5 days while they ran some diagnostic tests, and during that time, I had an angiogram, and that's when I found out that I occluded my kidney. They obviously asking me questions, and I was explaining to them brain fog and all the things that were common with the disease, even though I didn't know I was explaining them to them. And they finally did diagnose me with antiphospholipid syndrome.
Your experiences and that diagnostic uncertainty, but also being listened to about those individual symptoms, and as you say, eventually seeing a hematologist who, by the sounds of things, was wonderful. That must be phenomenally helpful to the second year medical students that you speak to, because it really highlights that kind of bigger picture thinking, which a huge amount of the people that I work with, I think, feel that they're not getting, they're not being heard, and they're not being investigated. And I think it's difficult because, you know, there were a huge amounts of constraints on public health in 2026, and a lot of the conversations that I have with people are about kind of trying to find the ambiguity in healthcare, but actually this is a really important story about when things aren't ambiguous, they just need more thorough history taking and more thorough investigation.
I think one thing that I've learned is trust your own body and learn to become your own advocate. I didn't really advocate for myself in the early years. I do now. Um, but I wasn't pushing things. I thought it was normal. But actually, if there's a nagging feeling in your head or you're feeling something, then go and discuss it with your healthcare provider, because it's really important that you make these things seen and heard. And it's something that I advocate to other people, but not only that, I advocate to my grown-up children. And I successfully got my daughter actually a diagnosis of antiphospholipid syndrome because I knew that something wasn't right, and I made her push as well. So, you know, you have to investigate these things. Don't think that you're a nuisance. just go and talk about it. And if you're not satisfied, I know a lot of people that aren't satisfied. They go, like, for example, they go to the doctors with a stomachache, they'll be told IBS, try this, try that. And unfortunately, yes, you do have to go through the process. I do understand there's stages and there's elimination, but there are reasons for things happening. So just if you're not happy, just keep pushing, keep pushing, keep pushing, and don't worry about coming across as being pushy. This is your health. This could actually be saving your life.
Yes, absolutely. And I think one of the things that I discussed in a previous episode was about the fact that actually self-advocacy is essential, because ultimately the way that as particularly kind of initial assessments happen a lot of the time, it's that we're kind of looking for the obvious thing. We're looking for the top couple of things on the list of differential diagnoses, and a huge amount of the people that I work with have things like fibromyalgia, and then they develop new symptoms. I was working with someone a couple of years ago who was vomiting every day, and she kept going to see the GP and saying, I don't think that this is my fibromyalgia, and it was just being put down to her fibromyalgia. And I was saying, well, one, theoretically, given that fibromyalgia is impacting the way that your nervous system processes things, anything could be, but it also doesn't mean that we can just kind of be blasé about it and say everything is. And as you say, this is your health. And sometimes the reassurance that people get from having things investigated, that's actually one of the big drivers of the experience that they have of their health. And when that reassurance is provided, or when more kind of clarity in that diagnostic uncertainty happens, whether that's that a diagnosis is provided or whether it's that it's ruled out, that can be really validating and really beneficial in someone's experience of their health. So I absolutely agree. And I think it would be really nice if somebody else could do it for you. But as you say, the self part is so important because you're the person living with these things. I do wonder whether there's something in that as well about the way that we often approach healthcare as people who, there's a kind of traditional way that people move within healthcare, which is that the healthcare professional is the expert and the patient goes and kind of says, here's some things, now you fix it, or now you tell me what's going on. And there are obviously times where that absolutely does happen. And then there are also times where actually it needs to be a much more collaborative and much more listened to version of that.
It should always be collaborative. I think the patient's input is really, really important. So when I'm teaching the medical students, for example, they are brilliant. They have a skill, but they have the textbook skills. Now, if you look up the textbook symptoms for antiphospholipid syndrome, it will be mostly pregnancy loss, of which I haven't had. So you don't always fit into a textbook. So actually, between the two of you, if you're a physician or a healthcare provider, the best instrument you have is your ears to listen to your patient. And if you listen to your patient and really take on board what they're saying, they are giving you the clues. They're giving you the clues. You're the detective. You have the background, the medical background, and you should be able to eventually put the pieces of the jigsaw puzzle together, which is the analogy that I use about my own condition, because I had all these things happening to me, and what had to happen for me to get a diagnosis was that we had to fit this jigsaw the pieces all together to make the perfect picture of what was going on.
I absolutely love what you said about the biggest tool that you have being your ears. Somebody said to me when I was at university, one of my lecturers, that being a good physiotherapist is 80% your subjective assessment. You should be beginning to kind of formulate what you are hoping the route that is going to ultimately be successful is from that conversation. And I think particularly when it comes to more kind of time limited appointments, I think especially if we kind of get stuck in this idea that by the end of that 10 or 40 or hour long appointment, we need to have had a kind of conversation, an objective assessment, and also have formulated and offered treatment. And when I'm working with people, I often say, well, actually, that initial kind of information gathering and understanding things from your perspective, it might take multiple sessions, but if that leads to us having a much clearer picture of how we can collaboratively try and help you to move forward, then that's been a success, even if it hasn't followed the kind of linear script of what people often expect of a healthcare interaction.
Yeah, definitely. I agree with that. Yeah.
In terms of pre-diagnosis, what helped you to begin to feel like you were able to have an impact on the situation that you found yourself in? And then also, what changed post-diagnosis in terms of how you felt able to navigate the situation?
So pre-diagnosis, I didn't have anything. I was lost, totally lost. I was trying to live life, but I couldn't live life. I didn't know what was going on. I didn't know if I was imagining it. I didn't know if I was making it worse than what it is, and everybody else just felt the same way that I felt. Having to call in sick and not being able to give a reason as well made me feel bad, made me feel guilty. Like, was I being believed, even not just by medical professions? Like I said, I did kind of feel believed with them, but didn't get any diagnosis. But with my work, especially, I felt like, and it may have been my own paranoia, but I felt like, do they believe me? Because I don't actually have a reason that I'm phoning in sick. I can't say it's because of this. I'm like, I just don't feel well, or I've been sick, or I'm in pain, or I have stomach ache. And it felt very, very flimsy. So I really had little. I was just trying to survive and cope before my diagnosis. And I think I'm probably one in many that's actually elated to get a diagnosis of a serious condition, because I was just so happy to know that, number one, I had a diagnosis, and number two, now I had something tangible that I could actually deal with, I could think about, I could understand, and I could improve my life. So it was actually post diagnosis that my life started to change for the better.
And I think you mentioned it again there, but the not fully feeling valid in the way that you're feeling, both in terms of your own perception of, well, if they are not being able to join all of the dots, then is some of this imagined, but also the way that you feel in terms of the way that you move in your relationships and in your work, in terms of not feeling that you have a, you can feel that your symptoms are legitimate, but also that they don't have an answer, and therefore they're not perceived as legitimate by your co-workers or the organization that you work for. Or, and I'm not saying you necessarily felt that because of them, and that it's difficult, because I think a huge amount of people, they do want diagnostic certainty, because it gives an answer to everything that they're feeling, and it kind of validates everything that they're feeling.
Yeah, I think it's important to be validated, even if you can't give it a diagnostic name. It doesn't necessarily mean need a diagnostic name, but to validate somebody's pain or the way that they are feeling is really, really important. It can affect different parts of your life. It is one of the reasons that my marriage broke down. Um, and that's how much it impacts work, I feel it was more my paranoia because it was never a problem at work. I wasn't under any discipline or conduct or whatever. If anything, I felt I had support, but like it was with me that I felt like maybe they don't believe me. But I had that self-doubt going on in my mind, remember, because like I was going to all these appointments, I was having biopsies done, having this done, having that done, and everything was negative or inconclusive. There was nothing pointing to anything except for, and I do wonder why they kept on with me, because there must have been something that was telling them that, they had to check me, but we just weren't getting the answers that we needed.
Do you think that it was something potentially to do with you and what you said before about being able to self-advocate for yourself? And I often think that there is a injustice in healthcare, that people who are articulate and able to advocate for themselves are more likely to receive that kind of thorough investigation and that thorough care, and people who present as potentially more challenging communicators or as potentially more kind of passively engaging with healthcare often get left. And then also I wonder, because 17 years ago, I think the health landscape was quite different. I had a very significant accident in 2012, and I feel like the care that I received versus the care that huge numbers of the people that I'm working with report to me that they're receiving is a completely different landscape. So I
Yeah,
wonder whether.
it's all changing. I mean, some things have changed for the better and some things are perhaps changing for the worse. When I was first introduced to sort of like the healthcare landscape, we had matrons on the ward, for example, so that was a long time ago. Yeah, things are improving and things aren't. There's a lot of restraint, and I think the NHS is a fabulous place, and we're so lucky to have the NHS. I think it is, the funding for the NHS is obviously under, a lot of distress. There's not the money there. They can't do everything, and I feel that the people at the heart of it are doing everything they can to with what they have. But that's why, as well, that it's really important to bring the patient into it, utilize the patient. I think the NHS long term 10-year health plan is a bit more self care as well. So, podcasts like this and some of the work that I do is teaching people the best things that they can do for themselves. And as we know, there's not one fix for each person is different. So the fix for each person is going to be different. And if we can just get people to know how to self-advocate, to know how to look after themselves as well as they are able to, through good sleep hygiene, good movement, if they're able to, eating well, and all those things, and learn to sort of like advocate for themselves as well as using the NHS as a health provider.
Absolutely. Yeah, no, I think everything there makes a huge amount of sense. And I think that this is the challenge when it comes to long-term conditions, is that when we're thinking in terms of really simple linear solutions, sometimes there are simple linear solutions to problems, and sometimes that is very much something that is either done for or done with someone. But actually, when it comes to living with any long-term condition, you're the person who's experiencing it, and you're the person who's living day to day with it. And it doesn't matter how many healthcare appointments you have, it's still not the thing that is actually going to help you move forward. The thing that's going to help you move forward is potentially the guidance and the collaborative approach from those appointments, but it's you going away and working on those things and working on things for yourself. And as you said before, the individual nature of Because I think living with a long-term condition is living, and only you are living your life. We're all individuals who are inhabiting our own lives, and that is going to look different for everyone.
Absolutely. So for me, the first thing was getting a diagnosis, so validating myself. The second thing for me was finding my community. So my community are other people with lived experience. Now, antiphospholipid syndrome is a rare disease, and I connected with the charity for that disease and also with a few people. But, you know, in my workplace, and I work with thousands of people, there's one other person that I know with antiphospholipid syndrome. But what I realised through the pain support group that I co-facilitate is that we all have the same things in common regardless of our diagnosis. So, for example, fatigue, chronic pain, lack of sleep, inability to do some things sometimes. And there as a community, we can share what works for us, and people can consider if the same thing could work for them. But it's also validating each other and supporting each other. So for me, community was a really big thing, finding that community that, you know, understands you, because unless you've lived with chronic pain or you've been chronically ill, it is really hard to imagine what it feels like to live with that type of thing.
One of the recurrent themes, I think, is isolation when you're speaking to people who have experienced or who live with most long-term conditions. But I think, yeah, definitely things which are those kind of more invisible illnesses, inverted commas. And I think, you know, a lot of the time when people think about these support groups, they worry that they're just going to be people kind of trying to outcompete who is living in the worst possible situation. But that is not the case in so many of these groups. And I think if you are unfortunate to end up in a space where it is primarily people venting without any support or moving forward, then actually not to kind of give up on that as an idea, because I think not feeling alone in this is one of the most important steps. And a lot of the time when I'm speaking to people, they'll say, oh, I never knew that thing. And I say, yeah, it's because you're living with this and nobody else that you know is experiencing it. And it's only when you have that community of people going, well, hang on a minute, I've got that too, and this is the way that I'm trying to work on that. And it's that benefit of the kind of peer support, assistance and learning is transformative, I think.
So I wanted to turn my pain into purpose, and I feel like I'm doing that. So pain is only part of our story. We all have a story, we all have a narrative, and we all have a life to live. And I tell you what, you know, I'd be damned. I'm not going to let pain take my life from me. I'm not going to let pain take my joy from me. This is something that I really and truly believe in. You know, what do you expect me to do? Lie down on my bed and weep and like never get up and never work and never experience anything? No. So this is where it comes into practice, that you have to find the tools that you need to be able to live a type of life. And this is the type of thing that, you know, we share our lived experience on the group, and we talk about pacing, we talk about benefits that you may be able to be entitled to. Now, I had a nightmare. When I was ill before my diagnosis, I applied for disability living allowance, and you know, this was a real struggle for me. You know, 3 times I got turned down, 3 times I went to tribunal. Each time I was winning at tribunal, and you know, just sharing best practice, supporting other people. And that's something as well that healthcare providers need to do. They need to look into everything about that person's life. What brings that person joy? Are they able to do what brings them joy? If it's going drag racing on a Saturday, what can we do for this person to enable them to go and watch drag racing every Saturday? For me, I found my joy in being creative, in being an advocate, and for improving things within the NHS, giving my lived experience and sharing my knowledge, because whilst I may not have a medical degree, I do have over 30 years experience of being in the NHS system. I've been in intensive care. I've had nuclear blood tracking scans. I've had MRIs. I've had gel scans. I've had endoscopes. I've had colonoscopes. I've had this test. I've had nuclear medicine tests. I've had Heliobacter tests. I've had all these procedures. I've been through such a lot. That wealth of experience has got to be valuable to the NHS, which is why it's so important to include the patient in everything that they do.
Absolutely. That figuring out what brings you joy alongside your pain, being able to identify why you still feel like yourself. And I think that can be really challenging, particularly when you're in this kind of period of not knowing what's going on. But ultimately, we do have a choice. So in the last episode, the person said, if doing the thing makes me feel bad and not doing the thing makes me feel bad, then I'm going to choose doing the thing because it's not actually changing the outcome, and then it is having that wider impact on my overall well-being. And I think there's a lot in this about kind of identifying what your values are. You said that you'd identified that creativity and advocacy and using your experiences to help other people to understand all of that stuff is kind of underlined by what it is that makes you feel like you, and how do you be yourself, and how do you feel the best version of yourself while still living with this. Because as you said before we started speaking, you are still experiencing, you're still living with these symptoms, and yet you're making choices about the way that you want your life to look. And I think that's exceptionally helpful and inspirational for people who are feeling really lost in this experience of their healthcare. So what surprised you most about what actually helped once you had your diagnosis?
So it was several things, really. It was my community, finding the people that I could talk to, that understood where I was coming from, and that we could share between us, things, and have that deeper understanding, and people that really knew what life might be looking like for you. And secondly was my creativity. So the very first thing that I actually did when I got diagnosed, so I went in for my 5-day diagnostic test and sort of like went back a week later, and that's when they diagnosed me. The very first thing that happened to me, in fact, the consultant took me by the hand and took me around the corner, and the charity for APS UK was situated in the building, and introduced me to the charity manager and gave me a leaflet, of which I brought home. And I looked at the leaflet, and I was kind of looking at the symptoms in the leaflet and what I'd been through. And I was trying to make sense of what it meant to me. And I came over with a really strong feeling of wanting to paint my condition. So I ordered a canvas and some paints, and I literally painted the symptoms of my condition one by one. And as I was painting, it kind of made sense to me. I dealt with what I'd been through in the past, and I kind of laid down my thoughts onto the canvas, and I was able to say, okay, that's happened to me. I've been there, I've done it, like, now what? And I started to look forward. So it was like a processing. For me, it was almost like a process, and I've continued to use paint and creation as a way of communicating things that I've experienced, like we've touched on before. One of the hardest things with having an invisible disability is that nobody could see it. Now, having double popliteal artery occlusion, I do have walking problems. I can walk, no problem, but the longer I walk is my feet go numb, I stumble, I'm in pain, my feet hurt. And I used to walk with a stick, not that I needed a stick all the time, but so that people could understand what it was like. Now I don't walk with my stick all the time. I have a fold-up stick. I take it out, and when I need it, I use it. But one of the things that is really, really hard for me was getting people to understand that just because you don't look ill, that you can be ill. So going back to the question, my creativity and my community, and also my advocacy. So sort of like using my experience to make hopefully somebody else's life easier or a bit better was something positive that could come out of what had happened to me. So like I said, I wanted to turn pain into purpose. I wanted something positive to happen because of the negative things that had happened to me.
I think, yeah, and I wonder what the kind of underlying reasons behind that response were, that you kind of went, right, well, this thing's happened to me and it's not great, but what value can I, one, derive from it, and two, can I help other people with? Like, I'd love to know your insight into why you felt that was the route that you went down.
I think it's probably genetic makeup. I think I've always been quite a positive person, and I do understand it's not as easy for everybody else. So many people have said to me, oh, you're so positive, you're so positive. So I will probably put it down to my genetic makeup, that I just have to be positive about things, because the way I look at it, and I think I touched on earlier, what am I going to do? Lie down on my bed and cry for the rest of my life? What joy is that going to bring me? I want happiness. I want to know that I've lived life. I nearly died at 30. Why am I going to let this kind of get in my way? Yes, it is going to be there. It is going to be constant. But let's see what we can do to make the best out of this.
I think it's interesting because we spoke about this before recording, but the kind of the positivity that you have discussed and have exhibited is one that's very much couched in real life. It's not that kind of toxic positivity, the what you said before we started recording about kind of the, if you just do this simple thing, then the cure will be within your reach. It's the positivity within the situation. It's the adapting to the kind of present situation and then going, right, what can I do with this, rather than the, I'm just going to be kind of optimistic even if my reality doesn't reflect that. Does that make sense?
Yeah, I think we all have a responsibility to ourselves, and that doesn't necessarily mean there's going to be a cure, but we do all have a responsibility to ourselves to look after ourselves the best that we can with what we have, whatever condition that may be. And that may come in the form of exercise, for example. Now, that's something that surprised me as well, because like, to begin with, early on in my journey, when people say, oh, you need to do a bit more, move a bit more and things like that, I was a little bit negative, actually. I thought of the sort of like toxic positivity sort of like type of thing. But actually what I've learned and what I now understand is that you don't have to run a marathon. You don't have to go to the gym 24/7. You do what is suitable for you. And suitable for me might be a walk around the block. Suitable for you might be some armchair yoga. But movement is quite important for the body. And if your body feels good, you're likely to feel a bit better.
And I think this is the difficulty with with the kind of movement approaches that we often have is that they are often really rigid. And so it's like, here's a sheet of exercises or here's a gym program. But actually, movement, I think, allows people to feel that they can participate in life a lot of the time. And there are people who can't move at all who are participating in life. But actually feeling a bit of additional confidence in your body and in your capacity to be able to move around your environment, I think it makes people feel better. And obviously that changes depending on how much movement they have. I'm not saying that, we just say everybody can and should move, because that's obviously not the case. But ultimately, I think it often comes down to participation. It's the feeling of being able to participate. And I wonder whether there's something in movement approaches when it comes to managing long-term conditions, which is that they can build the stamina or strength or flexibility to feel more confident in one's own body.
Yeah, I think upon diagnosis, there's again, there should be holistic pathways for everything. There should be holistic pathways for mental health. Like I said, I'm quite a positive person, and I totally respect that that doesn't come with everybody, and everybody's mental health setup is different, yeah. But even myself, who's a very positive person, I've had my mental health challenges on my journey, but it's through my creativity that I've been able to deal with that. But actually, should we not be signposting people, seeing, is there something more that we can help them mentally? Is there something more that we can help them physically? Is there something more that we can help them nutritionally? There should be this holistic sort of like care. Now, I know money isn't limitless, like we've talked about, but, signposting definitely needs to happen, or give people information, give them the information that may help them, places to look as well.
I think it's that joined up thinking, and that ultimately it feels like a huge amount of the kind of policy approaches to healthcare, no matter how well intentioned, are often based on kind of short-term outcomes. And I actually think what you've just said would save money in the long term, is if we had kind of better initial holistic care where people were having all of the facets of their health joined up and seeing what factors were likely to be playing a role, rather than saying, right, well, your knee and your hip and your elbow are sore and you've got fatigue and you're low in mood, so we're going to send you to 5 different services who are all going to address your individual body parts or mental states. And actually, when we're working with someone as a whole person and viewing the experience, the situation that they find themselves in as a whole, then that often leads to much better outcomes. But it feels like that often doesn't happen, partly because we're stuck in this kind of resource allocation problem that means that we just go, right, you're this thing, or your knee, for example, is that thing, so we're going down that route.
I think like just as you've been talking, sort of like, when you have a little bit of a light bulb moment, I felt like I just had a little bit of a light bulb moment. Actually, I think the first thing that actually should be explored if somebody's being diagnosed is the mental health. And I'll tell you why. Because it's through that mental health session you will find what's important to that person. Is it to run marathons? Is it because they can no longer work? Or is it because they've had to give up singing because they can't get there? So actually exploring the mental health should sort of like disclose what is important to that person. And then I think if you focus on what is important to that person, and it's going to be totally different for every single person, getting them and their mood high gets you to look after yourself in a much better way.
Yeah, I couldn't agree more. I think this is interesting because it's leading very much into the next question that I wanted to ask, which is, what needs to change in healthcare, education, or society. And I think we've already touched on some of these things. There needs to be a kind of wider recognition in our society that actually health takes loads of different forms and that people experience it differently. And also in healthcare, that we need to be looking at people as a full person rather than a condition.
Yeah, so I'd written down some notes before we started to think about these type of things, and yeah, exactly that. So first of all, let's value lived experience. Let's value the person that is living the condition that they have or living the pain that they have, and let's learn from that person and use the medical knowledge to get the best outcome. People do know their bodies generally. I can't give you statistics, but I'm sure out of every 100 person, maybe one of them might be exaggerating, but realistically 99% of people are going to be telling you the exact truth of what they're feeling. So listen to that person. See the patient holistically. What's going on in their life. Is this causing problems in their relationships? Is this causing them problems at work? What support can we offer them? Could they be entitled to anything? Like, do we need to write a letter saying that this person has this, and support them in that way, rather than them having to fight for everything that they get to support them? Do they need an occupational health person to go and visit them at their home and see if there's any sort of like aids and equipment that will help them? Think about money. Is this person struggling? Have they had to give up work? All these things are important to sort of like keeping people functioning in society. Have they had to give up their hobbies? Somebody with rheumatoid arthritis may have had to give up knitting. For example, they might have rheumatoid arthritis in their hands and they're no longer able to do the thing that gave them pleasure. Is there something else that we can offer that person that will bring back some kind of joy or pleasure to them, to give them a reason to think about, oh yeah, I want to keep myself well because Sunday I'm going to go singing, for example. Recognize invisible disabilities and validate people, because invisible disabilities, I don't know, I just feel like things have got better with invisible disabilities, but there's still a way to go. People still think if you look okay that you are okay, and that isn't the case physically and mentally. Don't assume that.
I think you've already touched on so many really valuable points, but are there any other messages that you feel that you'd like anybody who is struggling with their health to hear?
So anybody that is struggling with their health, just know that your experience is real and valid. Don't give up if you haven't got a diagnosis yet, and advocate for yourself. If you have got a diagnosis, then think about the things that maybe could bring you joy. Is there something small that you can change in your life to, bring back a bit of happiness? And remember that pain is only part of your story. Where is that person that you were before you had your pain? If you've grown into pain, if you've always had pain, then, be the person that you are.
And is there anything else that I haven't asked that you wanted to discuss?
I think I've touched on it. I'm just a big advocate for creative health. I've found creative health really, really helpful for me as a way to communicate, a way to process feelings. And for me, that comes in actual painting and exploring my thoughts and feelings. For other people, it might be movement, it could be dance, it could be singing. Creative health is often underfunded, but actually, as we've touched on through the podcast, that actually, if you're looking after your mental health, then quite often the physical health will follow as well.
Absolutely. Thank you so much, Tracy. I've really enjoyed talking with you, and I think so much of what you've said has been such a valuable insight. If what Tracy has shared today has resonated with you and you'd like to connect, you can find links in the show notes. Thank you for listening to the Conditions for Recovery. I'm George, and I'll see you in the next episode.